Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home. Hello, welcome to Boomer Health at Home. This segment is sponsored by Ameristaff Nursing Services, and we have a great lineup today. We'll be discussing the aging process of different organs in our body, primarily our skin, which is probably the largest organ, and I have a specialist to confirm that and validate that here today. We have with us Michelle Cimmerian Ducato, and Michelle is a PAC, and we're going to ask her more about what a PAC is. Good morning.
Good morning.
Michelle, how are you today?
Wonderful, thank you for having me.
Yes, well, you know, we usually like starting the show out by asking our guests to tell us about themselves, a little bit about themselves. Did you grow up, are you from this area?
I am. I grew up in Bloomfield Hills, graduated from Lasser High School, and now I live with my husband and a brand new 6-month-old daughter in Franklin.
Oh, that's great. How exciting. I like keeping this show local. So you went to college, you got a degree. Tell us a little bit about this advanced degree that you received.
So a physician assistant is a master's program, and after going to undergraduate, getting my college degree, I pursued a master's degree in physician assistant studies from Wayne State. And a physician assistant is essentially a national certified state licensed healthcare provider who is able to work in collaboration with and as an extension of a physician. Well,
you know, as the population ages and, you know, there's a shortage of physicians, I would think that a physician assistant is a, you know, the way to go from the standpoint of serving more of the population. But you're kind of in a specialized area of that. Do you want to tell us a little bit about the specific area that you decided to focus on?
Sure. So I practice in dermatology, and I'll talk briefly about the things that we're allowed to do as physician assistants. We are allowed to examine patients, diagnose and treat various conditions. We can do procedures, prescribe medications. So all of these things apply to dermatology, where I work. And I work with 2 board-certified dermatologists, Dr. Emily Lighten and Dr. Ross Brothers. And I knew before starting PA school that I wanted to be in dermatology. I've always loved the skin. I've loved skin care, skin health, and I love being able to work in an outpatient setting and help people improve not only the look of their skin, but the health of their skin as well.
Now, I understand you come from a family of healthcare people. You want to tell us about that?
Absolutely. My father is a physician, and he was in internal medicine. My mother is a nurse, and my husband is a family practice physician. So kind of all my life I've grown up around healthcare providers and was very inspired by that when choosing this profession.
Well, you're certainly surrounded by healthcare professionals, so it's no surprise that you went into the field yourself. When we talk about skin, is it a continuous aging process?
It is, absolutely. So usually we don't see the signs of aging until about 25 years old. And so much of that depends on genetics and lifestyle, but you know, everybody always talks about how baby skin is so soft and wonderful, and then as we get older, we really start to see some of the effects of not only our genetics but also environment coming out. And again, that starts around the age of 25 when we may start to notice some fine lines or a little bit of a loss of volume, and then it kind of continues on and becomes more apparent as we age.
I see. Now, there are certain skin conditions that may be hereditary. Possibly.
Absolutely, yeah. So genetics plays a very big role in skin aging, and we can think of skin aging as in two categories. One is intrinsic aging, which is really driven by genetics and hereditary things such as your skin type, your ethnicity. And then there's also extrinsic aging, which is more due to environmental factors, for example, sun exposure throughout your life, a history of sunburns, tobacco use, how you took care of your skin and your body throughout your youth.
Yeah, these are all important points because a lot of people don't realize, for example, tobacco use, what that does to your skin. I mean, I'm sure there's evidence that it ages it prematurely, correct?
Absolutely. Not only from the ingestion of tobacco, but also being around the secondhand smoke that can certainly take a toll on the skin.
Well, so, I mean, I'm sure there's many, but what are some of the preventative things that people can do to reduce their exposure and keep that youthful look, like you have?
Thank you. Well, one of the most important factors is sun exposure over time. So when we're young, it's really important to protect our skin from blistering sunburns. What we know is that having multiple blistering sunburns when you are younger can significantly increase your risk of developing skin cancer as you age. So using a lot of sunscreen and avoiding the sun during peak hours, trying not to get any sunburns or tan, too extensively. Avoiding tanning beds is very important, even though there are claims out there that there are some safe tanning beds.
Yes.
None of them are safe. They are all dangerous. But also other things like staying hydrated, avoiding excessive alcohol, avoiding smoking, for example. And really taking care of your body from the inside out can have a very large effect on how your skin ages.
There's such an emphasis nowadays on that youthful look, and I even in the business world, I'm sure there's studies that show that executives, the younger they look, the more apt they are for the promotion, possibly. But what is the main reason people come to you? What in your practice? What do you? And I'm calling it your practice because you do have a practice. And why do people come to see you?
Well, I would say most people come to our practice for a variety of reasons. So we treat in the pediatric population, for example, we treat common things like acne and warts and eczema and things like that, rashes. In the aging population, we treat skin cancers. We do a lot of full body exams where we have people coming in to get different moles looked at or spots that they're concerned about. We do recommend skin checks for most adults once a year. So it's really important to kind of be aware of the changes.
And now I want a youthful look. So I dial you up, I make an appointment, and I come in to see you. What are some of the things that you can offer me?
Well, we have multiple procedures that we offer at our office, and that is absolutely a rising concern of all ages nowadays, is how can I have a more youthful appearing skin. We have different lasers that can treat pigment changes, for example. We have different kinds of chemical peels that can address certain conditions of the skin, so not only medical conditions but also more cosmetic conditions or concerns that people have. We have different types of fillers. We have neuromodulators. So we have all kinds of things, and that's also why it's very important for patients to come in and get a customized consultation, because everybody's skin is so different and everybody has different needs and concerns. And so we can really put together an appropriate package for your skin type and for your main concerns.
Is it important to use facial creams at nighttime, for example? Sure,
I think it's absolutely critical that you are on a good daily regimen of skincare that usually includes some kind of moisturizer at night. And again, everybody's a little bit different. So if it's a cream for some people, a lotion for some people, we absolutely encourage people to be using products that have active ingredients that can help over time prevent the fine lines and wrinkles and the discoloration of skin, but also correct some of those issues too over time.
I see. And we hear a lot nowadays about Botox, and of course Botox is used for a variety of different conditions. But in your practice, tell us a little bit about Botox and how it works. First of all, it's a very highly toxic ingredient, isn't it?
Not really, not when we're using it for cosmetic purposes.
Okay.
So botulinum toxin, yes, can be dangerous when ingested from the bacteria, but Botox is derived in a way that makes it virtually non-toxic when we're using it for cosmetic purposes. So I'll explain it briefly, but it's what we call a neuromodulator. So we inject it into a muscle, and essentially what it does is sort of prevents that muscle from firing and prevents you from excessively making a certain expression, which has led to the wrinkles that you're concerned about over time. So I'll give you an example. The little lines in the forehead that some people refer to as the 11s. Those are made from frowning and furrowing your eyebrows over time for many years. And when we inject Botox into very precise locations in that area, we can sort of slow down or relax the movement of that muscle, thus smoothing out the wrinkles and preventing those wrinkles from deepening. So not only is it preventative, we see that in some of the younger patients that are coming in, but also it's corrective, and we see that in some of the older patients that have more established wrinkles.
Yeah, so it shouldn't be confused though with a permanent wrinkle, right? Like it doesn't elevate the skin to eliminate the wrinkle.
Correct.
It just, when you make certain expressions, it stops those
Yes.
wrinkles from appearing.
Yes, and over time it does if you get regular treatments. Usually it lasts about 3 to 4 months, but if you do get regular treatments, it will over time smooth out those wrinkles so they
really?
are far less apparent. But it does not add volume, as you mentioned, to these areas.
So, Michelle, do you inject the Botox into the area? Who does that? Is it a doctor or is it a technician? Do you do it?
In our office, it is both physicians, both dermatologists and myself. And we always recommend that you see somebody who is board certified, a healthcare provider, not just an esthetician.
Yeah, because we hear a lot of times about these Botox parties.
Yes.
Now, is that something that's recommendable, or?
Well, yes and no. I will say that as long as the person that you're going to is a medical professional and understands facial anatomy. We have 43 different muscles in the face, and if injected improperly into the wrong area, then we see more concerning side effects, for example, an eyelid droop or some undesirable effects of relaxing the wrong muscles.
You said it prevents the muscles from firing, but that's interesting because I know they're starting to use it for pain relief too.
Yes,
in
they have
certain
been.
situations.
Yeah.
Because a muscle that continues to fire, and that's a good term, might be hitting a nerve, or it kind of rests everything in certain areas that may cause pain. So how many types of injectables are there? I mean, probably many, but what are some of the common ones?
The most common ones that we see are hyaluronic fillers, so hyaluronic acid fillers, excuse me. And basically what hyaluronic acid is a sugar gel that our body naturally produces. And as we age, we lose some of that volume over time, and so these products are synthetic hyaluronic acid products that are fully dissolvable. So if you ever don't like the way that it looks, or if there is any kind of complication, we can dissolve them. But those are the most common ones, and there's all different products within a hyaluronic acid. We have very gushy, soft, natural feeling ones that people, for example, like to put in the lips or in very expressive areas around the mouth. But then there are more substantial, firm products that are also hyaluronic acid that we can put in deeper areas.
Now, how long do these injections last?
It depends. So usually the indication is about 9 months up to 2 years. So it just depends on which product that you're using and where you're injecting it and how much you're injecting.
I see. Now I have to ask this question. I mean, does insurance pay for any of these?
Unfortunately, no.
Okay, cash only, right?
Cash only, yes.
Well, it's an investment though, right?
It is.
You're investing in yourself.
Absolutely.
And, so if you're active in the workplace, or you just want to improve and move to a youthful look, you know, the ROI, return on investment, is probably tremendous.
And I will, if I could just mention too, I think a lot of people are really afraid of these treatments because they've seen people who may be overfilled or have filler in the wrong places. So it's very important to understand also who you go to do these, so that you can look natural and retain your very natural youthful appearance.
Now, we hear about 16-year-old and 18-year-old girls getting these procedures done. Do you recommend that, or is there a certain age where you have to say no, but okay, after 25, 30, it's okay?
Yeah, I think 16 to 18 is a little bit young. You know, what we're seeing in younger women and men, though, is they want to be more preventative. So we do see younger patients doing Botox in their 20s. And again, because it does prevent those muscles from activating, it can prevent those wrinkles from forming. So we are seeing younger patients that are more interested in these cosmetic treatments, and it's from a preventative standpoint, whereas people who are maybe in their 50s or 60s coming to us are looking more for a corrective treatment. But what we see is that the earlier you start, you know, if in your 20s to late 20s or 30s, the less you need over time because you don't have to correct as much.
I see. But yeah, so the older you are, though, for example, let's just use myself as an example. Probably a good before shot. We can't see the after shot probably, but you know how you see once in a while on the internet, you know, the before shot and the after shot.
The 10-year challenge recently, I think, was the big one.
So let's say the fillers would probably be good right in here, right, to elevate that and get rid. What do they call these?
The nasolabial folds.
Okay, or frown lines?
Sure.
Sometimes.
Yeah.
Okay. So that would be, a filler would be helpful in here, right?
Yeah.
Elevate that kind of.
But what's interesting too, and oftentimes patients come in and they see something that they'd like to correct, and they think that just by, for example, putting filler here is going to correct that. But really, when you look at the face and you understand it as a 3D structure, you can see that sometimes people need a little bit of an injection in the cheek to sort of lift up that fold. So it's really important that you get a proper assessment and consultation.
Now, are these procedures considered surgery?
No. They're not. They're minimally invasive. They're not surgical in any way. Some of the side effects that we see are a little bit of bruising and swelling, but for the most part, they're very tolerable without any downtime.
Do you need to anesthetize the patient?
We like to use local numbing, so we just put a little bit of anesthetic cream or ointment on, and there's also lidocaine built into most of these products. So as we're injecting it, the area, it's kind of, sometimes you feel a little bit like you've been at the dentist after getting a treatment done.
So they don't hurt?
I mean,
just the thought of someone sticking a needle in my face, you know, but so many people get it done.
Yeah, it's very tolerable. It's not quite like getting a massage or a facial, but it is very tolerable.
Now, is there any side effects?
There can be, yeah. So the most common side effects we see are a little bit of bruising and swelling, and depending on the area that we're injecting, some areas are highly vascular and are just more prone to bruising. For example, the lips and under the eyes and these tear troughs. We always say to expect some bruising and expect some swelling, and if you don't have any, that's wonderful. But there can be some more serious complications. You know, for example, injecting into an artery or a vein which is again why you need to go to somebody who understands facial anatomy and understands what to look for with complications.
Now let's talk about abrasions, facial abrasions. Now, is that the common term to use?
I think it was, and the technology has increased and we've come so far in terms of the different treatments that we can do that we don't really refer to it as abrasion anymore, but in our office at least, we have, we don't do microdermabrasion in the old sense of it. We offer hydrofacial, which is kind of like a super abrasion. So you can think of the old microdermabrasions like a palm sander, where they're sort of sanding and buffing the surface of the skin, and the hydrofacial machines now can really infuse deeper into the pores, and we use all kinds of customized serums and enzymes to really penetrate the skin. So we're infusing and hydrating as well as exfoliating, whereas the microdermabrasion, the traditional microdermabrasion, is more just exfoliation.
Now, I would think that that's somewhat permanent though, right? I mean, you can eliminate, like, for example, somebody that had acne when they were younger and they have marks on their skin. how would you address something like that?
So there's numerous ways, and again, it really depends on how bad your scarring is and how substantial it is, if there's discoloration associated with it. There are different kinds of microneedling treatments that we can offer, along with different serums, a series of chemical peels, a series of laser treatments that can really retexturize and resurface the skin and address some of the deeper pitted scars.
I see.
And that is permanent, yes, that is permanent.
Okay, so is a chemical peel different from an abrasion?
A little bit. It's a different mechanism for how the skin is exfoliated. So we use chemicals to sort of paint on the face, and then you over about a week or so shed some of that dead skin and really stimulate those deeper tissues in the skin to produce more collagen and elastin.
So if you were a consumer, patient out there, a viewer, and you were looking to get a consult, what certifications would you look at, ask for before you went forward with any kind of procedure?
You always want to be looking to make sure that your provider is board certified. So whether they are a physician or a physician assistant, or there are nurse practitioners that certainly do quite a few injections and procedures as well. And if you were to get chemical peels or laser treatments, there are many estheticians that perform that. Again, you want them to be licensed. And one of the most important things to look at also is before and after pictures of patients that those providers have treated. So you want to make sure that you're getting good, solid proof that this person is able to do the things that you are looking for in a natural way, or a way that you find appropriate.
So if you were a beginner at this and you wanted to go in and get a touch-up, what would be the most basic areas that people come to see you, and the first place to start? I mean, because you could probably get addicted. I mean, we've heard stories about people addicted to this kind of stuff, but just for a general refresher, what are some of the things that you would recommend?
So it really depends on what your main concerns are. So we often see people whose main concern is pigment issues. For example, they have blotchy skin or an uneven pigment. So something like that, we would start maybe with some chemical peels or some laser treatments. We can use light therapy to really break up a lot of that old pigment and give you a more even skin tone. And there's many people that are concerned about some wrinkles, and Botox is usually a really common place that we start with, sort of establishing a anti-aging regimen.
I see. Can we talk real quickly about skin cancers?
Yes, of course.
Okay, so it's common, we have to discuss it. But as we age, I mean, probably the risk increases, right?
Absolutely.
All the years of exposure to all the sunburns. What are some of the things that we should look for upon self-examination?
Sure. So I think it's really important for people to be at home looking and being aware of some of the spots on their body. So that way you can kind of see when new spots come up that could potentially be concerning. Some of the non-melanoma skin cancer maybe signs or something that might prompt you to come to a dermatologist would be sores or pimple type sores that aren't going away after a couple of months, red patches that have peely skin that continue to come back in the same place, any mole that itches, burns, hurts, bleeds spontaneously. Those are absolutely concerns for somebody to come and get a skin check. If you were to develop a new mole that was growing really quickly, there's I don't know if you've heard of the ABCDs of melanoma, something that has asymmetrical borders, asymmetry in the shape, changing colors or multiple colors, evolution and evolving, changing mole. So those are definitely some warning signs.
Well, these are all excellent tips to offer our audience, and because it's something that we have to deal with. And so the first line of treatment, you might go to your internal medicine doctor, right?
A lot of people do.
But at some point you need to see a dermatologist too.
Yeah, we recommend that most adults have an annual skin check once a year.
Yeah, and your internal medicine doctor will probably refer you to a dermatologist.
Yeah, many of them do.
Is that correct?
Many of them do.
And a full body check would be basically head to toe,
head to toe,
back, front.
Yep. everywhere the sun doesn't shine.
And you know, it's so important to self-diagnose yourself as the first step, and to just be aware of your condition, and as you see things change, I'm sure it's important to get in to see a professional like yourself.
Absolutely, but we also find that sometimes patients don't realize that they have things that are concerning on their skin. So just be aware of what you read on the internet, as we always say.
Well, we're coming to the end of the show. Is there anything else that you would like to add? It's been really informative.
Yeah, absolutely. I would say that we definitely recommend that everybody get once a year skin checked by a dermatologist, a board-certified dermatologist, and we would love to see you for a consultation for any kind of skin concerns that you have, and wear your sunscreen, stay hydrated, and take care of your skin.
I'm making an appointment on Monday to come and see you.
Looking forward to it.
I'd like to thank you for coming in, Michelle Samarian-Picado, and for sharing this valuable information with us. You've been watching Boomer Health at Home, and I'm your host, Greg Jamian. Thank you.